Okay, let's be real. Parenting is not easy, but you are not alone. Welcome to The Parent Prescription, a podcast where I will be giving you real practical advice to help navigate the ups and downs of raising healthy, happy children without losing your mind. Welcome to today's episode where we're diving into atopic dermatitis, more commonly known as eczema. All right? This chronic inflammatory skin disease affects millions of children and adults worldwide, often causing dry, itchy, pruritic, painful skin. But atopic dermatitis is more than just a rash. It's a complex condition caused by genetics or the immune system and environmental triggers. It can have a major impact on the quality of life of certain people, and it can affect sleep and your mental health. So in this episode, we'll explore what causes atopic dermatitis, how it's diagnosed, the latest treatment options, and give you practical tips so that you can manage the flare-ups, okay? So whether you're living with eczema yourself or whether you're caring for somebody who has eczema, I want you to simply understand the science behind it and the conversation that I can give you with valuable insights and support. So let's get into this dose with Dr. C. So it's called so many different names, right? We've got eczema, we've got flexural eczema, atopic dermatitis, contact dermatitis, regular dermatitis, dry skin. So many different ways to name it, but what is it actually? Right? What is it actually? Atopic dermatitis is a chronic condition where the barrier of the skin is just, to keep it simple, just not working as well, right? And so irritants can get in and things can make the skin really itchy. And when we scratch it, we make it worse. And so it's like a bad cycle. It itches, we scratch, the scratching makes it worse, it inflames the skin, and then it's just a repeat cycle. Okay? And so the first thing that I want you to understand is nobody is at fault. There's nothing that the parent has done wrong to give the child eczema or atopic dermatitis, okay? So there's not there's a misunderstanding that it's something that has been done or something that has been used to cause it. That's not the cause. Now there's things that we can do to eliminate or to help, not eliminate, to help it, but it's not the cause of it. And so if you're ever wondering if it's contagious, it's not. It's not contagious. You can have flare-ups where you go, okay, I thought I had it completely taken care of, and then all of a sudden, as soon as winter hit, it flared up again. And now we're going through the same thing. That's pretty common. If you ever wonder if you are managing it well with the things that were given to you by the doctor, you've got the moisturizers, you've got the creams that you're using, and then things are doing well and then they stop working. That's another thing to understand, that it's a chronic condition. It's not something that's usually short-lived or short-term. It's a chronic thing that you always have to maintain, and then teach your children how to maintain it so that they can continue to know how to treat it, okay? So when does it start? Usually it starts in infancy. You start to notice as early as brand new babies that they have sensitive skin at the beginning, and then we start to notice dry. For babies, usually it's the cheeks, or it can actually be all over, like just a dryness, a roughness of the skin. Some of them feel as rough, we call them elephant skin. They're that rough. But the first thing that usually a provider will do is say, okay, well, if they're little babies, what kind of milk are we on? Let's see if this is an issue with the milk, okay? Is it sensitivity? Because that's all babies have, right? It's milk. And so is it a sensitivity to the milk? Can we notice a difference in our skin if we change the milk? Or if we have mom that's breastfeeding, go dairy-free for 2 weeks to see if the skin itself gets a little bit better or clears up, okay? The other things that will be done when they're babies is we'll start to remove any fragrance products. Even though we love how Johnson & Johnson smell, we would start to say, okay, don't use that. Why don't you try something simple like Dove or Eucerin or CeraVe, something really simple with no fragrance, no smell, and moisturize more often and keep any fragrance, even fragrance wipes, keep all of that away and see if it gets better. So it's a process to see what makes it better, okay? Things like perfumes and colognes. When you have a baby, we would tell the parents to spray your cologne and your perfumes on your back and not on your front. Why is that? Because an irritant, the smells, the fragrance, the lotions that you use, if you love certain smells and fragrances, it can irritate the baby's skin when they're loving on you, right? And so we'll start to take things away to see if it gets better. And that usually works, okay? What frustrates most parents is it works for a while and then you still notice that we've got ups and downs. And that happens. If it gets bad enough, the provider will give you steroid creams or steroid oils. But we try not to do that unless it's not manageable with just moisturization. The more you moisture, and I'm not talking about just once after bath. I'm talking about literally several times a day, putting a thick white cream or lotion on the body so that it can keep that moisture in, okay? And so that's for babies. Usually with older kids, it's more, around the wrist, the hands, the elbows, behind the knees. Usually it starts to become the flexus, what folds, things that fold, right? Behind the ears. So those are more common with older kids, unless they have severe eczema. That's the more common places for those. Usually those are manageable also with Aquaphor, Vaseline, thick lotions, but it may have to use creams like hydrocortisone or triamcinolone. These names, I know these are big names. No, don't worry about it. It's just steroid creams that may have to be prescribed to help decrease the inflammation and decrease the itching, because the more they scratch, the worse the skin will look. And so we try to keep them from scratching, the nails cut low, and keep them from scratching so that it doesn't open up the skin and get infected, okay? So the main thing that we can do is try to keep the skin moisturized and eliminate some of the itching with moisturization. Now, a big question is, why my kid? Or why me? Why my kid? Why does my kid have it? So we have to think about things like genetics. A lot of times it runs in the family. Okay, so you go, oh yeah, mom has eczema, sisters have eczema, grandparents. It just runs in the family and it's genetic. And that's nothing what we can do about genetics, right? Another thing is allergies, eczema, asthma. Those are like best friends. They're besties. So if your kid has allergies, they are more prone to have eczema. Okay, so we have to think about those things too. Now that doesn't mean they're going to have all three. I just like to make sure people understand that those three things are friends: allergies, eczema, and asthma. Okay, and so a lot of times you'll see 2 out of the 3 or 3 out of the 3 in some kids, and they can that can be a comorbidity, or what we call a cofactor. What are some triggers? Some triggers for atopic dermatitis or eczema. So when we talk about irritants, we've already mentioned a couple, like fragrance lotions, fragrance soaps, fragrance detergents. So that's another thing. These nice, strong smelling detergents are not very good in kids that have eczema. So you have to kind of keep it simple, like All Free and Clear, Drift, Tide Free and Clear. Keep it really simple when it comes to their detergents so that that's not a trigger. The environmental changes. And so when you think about the weather, especially here, going up and down, that's a trigger sometimes for a flare-up of our dry skin, itchy skin, and our atopic dermatitis. And so the moisturization helps, especially when we go from being hot to cool. The cool weather will dry the skin out. You have to moisturize it more. If they have seasonal allergies, anytime we have a weather change, that would also be a time that our skin will flare up. And you have to take care of using your allergy medicines to make sure that we're taking care of the allergies, so it can also help take care of the skin. And so those are some triggers of eczema. Now, one thing you have to understand is not being clean or hygiene is not the reason for eczema. Uncleanliness is not the reason for eczema. If we're scratching and we're irritated and we're also unclean, that can make it a risk for infection, but that's not the reason for eczema. Normal eczema care. When we talk about daily care, a lot of people will ask me, can they have baths with soap? Yes, they can have baths with a gentle soap like Dove, Ivory, Caress, Basis, the white non-fragrant soaps. But yes, they can have a daily bath, but you don't want them to be in the bath for long periods of time. You're getting in the bath, you're doing your bath, and you're immediately coming out after your bath. Short baths, right? And then right after the bath, pat dry, not completely dry, and then go ahead and moisturize all over the body. And that helps, okay? Sometimes with severe eczema, a dermatologist will tell you to keep them wet or wrap them in the wet towels and then put their pajamas on for a little while. And you would think, really? But that kind of soaks in some of the moisture too and helps. But that's with severe cases. So do not try that unless it's told to you, okay? But daily moisturization. So we're not talking about just at bedtime. Multiple times a day, making sure that we have a good thick lotion. Eucerin is a good one. CeraVe moisturizing lotion or cream. Vana cream, VANICREAM. Vana cream is another really good one. And you can seal it in if you need to with Vaseline or Aquaphor. After you moisturize them, seal that stuff in because they soak it in really quickly sometimes. Okay? So we talked about short baths, the moisturization, and the continued use of your allergy medicine if allergies play a role in your if allergy plays a role in your eczema. So again, we try to minimize medicines if we can, but medications sometimes have to be used to calm everything down. And so what happens is usually the provider will prescribe a steroid cream or ointment to use in the worst places, and they'll tell you to use it twice a day for a week, and then once it calms down to go back to just using your moisturization, so that you do not have to get dependent upon using steroid creams constantly. The antihistamines to decrease itching. If you have to use a little Benadryl at night so we're not scratching so much, then that will be another thing. If we have to use Zyrtec during the seasons that we have allergy symptoms, that would be something else that decreases the itching, okay? And so steroid creams are usually part of the process when things are flared up, okay? Rarely do we use oral steroids. You know, in really severe cases, they'll give you a burst of oral steroids and make your kids take it by mouth, steroids by mouth, and then they'll go back to just using the creams and the ointments. One thing we try not to do is have you on oral steroids for a long period of time. Food allergies. Can food allergies cause eczema? The simple answer to that is yes. Depending on what, you have to actually have a diagnosis of these food allergies, okay? Because sometimes it's just whelps and it's not eczema, and so we start to say it's eczema because we've got food allergies, but it's really just an allergic reaction to the food. And so it's a really fine line there. But certain foods can trigger eczema, and that's usually why there will be some testing done, some blood testing or skin testing to see if we've got significant food allergies and see if that's actually creating more of a problem with the skin. But yes, the simple answer is yes, certain food allergies can trigger eczema to be worse, okay? That's one of the reasons why some kids with eczema are referred over to dermatology or allergy to the allergy specialist, because if it's not responding to the treatment that's being used, there's no response, then we have to figure out if there's something else that's going on. Because sometimes, it's not all the time, it's rare, but sometimes there's other reasons why it's not responding to the treatments that are being given. I see eczema very often, especially this time of year, but do you have to always go to the pediatrician's office every time the eczema flares up? The answer is no. Once you know what to do, so of course you have your daily regimen that you using your moisturizing creams, your moisturizing lotion, your short baths, your cut nails, you're doing all of that all the time. And then you have a flare, you don't have to go to the doctor each time if you have the items to use. If you go, okay, here we go again. Right here, there's a patch that we just keep scratching and it's looking bad and it's raised and rough on the skin. You pull out your creams that you have. You pull out your hydrocortisone or your triamcinolone cream and you use that twice a day for 5 to 7 days. You get it under control and then you go back to normal. You don't have to spend the time coming in for that if you know how to manage it. After a while, you will learn how to manage the eczema. Okay? The reasons to bring the kiddo in is if we're oozing or draining from the areas. If it's warm to touch or red, if you go, why is that area hot? Or if it's painful, we can't sleep because it's hurting. The areas are hurting. There's a smell or an odor to the areas because we've been scratching and it may have actually got infected. Okay? These are reasons to bring them to the doctor. Or you're doing everything that you've been taught in the past and it's just not working. You're like, okay, I've done it all. I'm doing everything they told me and it's not working. That's a reason to say, okay, I just need to come in. I need to come in and get more instruction, or maybe we need to increase the percentage on the creams. So there are other things that can be done when it's not working. Okay? So the main thing I want you to know is that, number one, eczema, atopic dermatitis is common, very common. Okay? It is genetic, but it can also be where it's nobody else in the family had it and it just so happened to be the lucky kid that got it. It is manageable. We have to manage it because it can be very irritating to deal with dry, itchy, rough skin all the time. It can mess with sleep if we're not maintaining it. It can mess with school because they're too busy scratching and itching. They're not focused. We have to make sure we're taking good care of the barrier. The skin is a barrier to our body, and so we have to make sure we are taking care of it. So make sure you use this information and this knowledge so that you can know the basics of what to do with dry skin and eczema, and then use that to say, I know when to go in. I know when I need to, this is not working and I need to go and see my provider or my pediatrician. So do not feel like you are at fault for eczema. There's nothing that you've done, but there are things that you can do to help it. Okay? Thank you for tuning in to the Parent Prescription. I hope this has helped this time of year. Because this is something pretty common when the weather is cool. If you have questions or concerns, or if you want to be seen, talk to your provider, or if you are one of my babies, bring that kiddo in here and let me check that skin and see if there's something else we can do. So, thank you for listening.
Artlist.io. Step by step, raise the whole room higher.